Are you finding that getting and keeping an erection isn't as easy as it used to be? Perhaps you've noticed a gradual decline, or maybe it feels like things just aren't as firm as they once were. Even when you are alone, it's a frustrating, often unspoken concern for many men as they get older. A quiet worry that can chip away at confidence and intimacy. You might try harder, perhaps even resorting to more intense methods, hoping to force a response. But instead, it feels like you are hitting a wall. What if I told you that one of the very habits you might be engaging in privately, perhaps with the intention of maintaining your vitality, could actually be silently working against you, actively diminishing your ability to get hard as a penis surgeon? I have seen firsthand the subtle yet significant impact certain practices can have over time. In this video, we are going to uncover this common mistake and then explore practical, gentle approaches that can help you regain sensitivity, improve blood flow, and rekindle your natural ability to get and sustain firm erections, all while fostering a healthier relationship with your body. Watch to the end, because there is something truly surprising that could change how you think about this topic forever. Let us dive right into what many men over 60 are unknowingly doing that can subtly but surely damage their erectile function. The mistake I am talking about, the one silently killing your ability to get hard, is often an unconscious habit relying on overly aggressive, high friction, or singular masturbation techniques. For many men, especially as they get older, there is a natural tendency to believe that more intensity, more pressure, or more friction will somehow compensate for a perceived decline in erectile function. Perhaps in younger years, this approach might have worked, but over time, it begins to create a serious problem. Think about it this way: your penis is an incredibly sensitive organ, packed with delicate nerves and blood vessels that are crucial for arousal and rigidity. When you consistently expose it to excessive friction or pressure, especially with a very tight grip or a dry hand, you are essentially desensitizing these nerve endings. It's like shouting into a microphone all the time. Eventually, your ears become less sensitive to normal conversation. The continuous rubbing and forceful stimulation can cause micro-trauma to the tissues, leading to tiny, almost imperceptible scars. Over years, these microscopic scars can accumulate, reducing the elasticity of the penile tissue and impairing the healthy flow of blood, which is absolutely essential for a firm erection. Furthermore, your brain and body become conditioned to this very specific, often extreme, level of stimulation. When you then try to achieve an erection in a less intense, perhaps more natural or intimate setting, your body struggles to respond because it is accustomed to a much higher threshold of sensation. This creates a disconnect, where the natural, gentle touch of a partner, or even your own light stimulation, just does not register enough to trigger a full erection. It is not that you are no longer capable. It is that your system has been retuned to an unhealthy frequency. Now, the good news is that you can reverse a lot of this. The first crucial step, and the solution to this problem, is to shift towards a more gentle, varied, and well-lubricated approach to self-pleasure. Instead of focusing solely on friction or a forceful grip, the goal is to reintroduce and explore sensation. Think about it like a sculptor working with clay. You want to be delicate and precise, not brute force. Start by using a generous amount of lubricant. This is non-negotiable. Water-based lubricants are generally best, as they are body-safe, easy to clean, and less likely to cause irritation or damage compared to dry skin or harsh substances. The lubricant reduces friction dramatically, protecting those delicate nerve endings and preventing micro-trauma. Next, consciously vary your touch. Instead of one consistent, strong grip, experiment with different levels of pressure, from very light and feathery strokes that focus on surface sensation, to a slightly firmer, but still gentle caress. Change your rhythm and speed. Explore different areas of the penis, not just the shaft or the head. Spend time on the underside, at the base, and around the pubic area. The idea is to awaken a broader range of nerve endings and to retrain your body to respond to a wider spectrum of stimulation, much like a broader range of musical notes. For example, I had a patient, a gentleman in his late 60s, who came to me frustrated by his inability to get fully hard. Even though he felt desire, he admitted to using a very tight, rapid grip for years. We talked about this very issue, and I encouraged him to switch to a softer, open hand technique, using plenty of lubricant and focusing on slow, deliberate strokes. He was skeptical at first, but after a few weeks, he came back with a big smile, saying that not only was he achieving firmer erections, but the experience itself was far more pleasurable and less like a chore. He was reconnecting with sensation in a way he hadn't in decades. Understanding the importance of gentle touch is just the beginning. Now, let us talk about how you can retrain your brain and body for a more natural, responsive experience. Moving on from the physical act itself, let us explore how your mind plays a crucial role in your ability to get hard, and how you can actively engage it for better results. The continuous reliance on overly aggressive techniques often creates a deep disconnect between your mind and your body when it comes to pleasure. When self-pleasure becomes purely mechanical, a race to an outcome, your brain starts to treat the experience as a task rather than a journey of sensation and connection. This is why many men find that even when they are aroused, their body just does not respond as it should. The mental connection is there, but the physical response is not. This brings us to our second solution: incorporating mindfulness into your self-pleasure. Mindfulness simply means paying attention to the present moment without judgment. When you engage in self-pleasure, instead of rushing or focusing solely on the end goal, take a moment to truly feel what is happening. Breathe deeply. Notice the warmth, the textures, the subtle shifts in sensation as you explore different touches. It is about being fully present in your body and allowing yourself to experience pleasure in a more holistic way. This practice helps to reestablish the mind-body connection, retraining your brain to associate arousal with natural, gentle stimuli, rather than just extreme friction. It also reduces performance anxiety, a common issue that can sabotage erections, because you are no longer focused on forcing a response, but rather on simply experiencing and allowing. Many men find that by adopting a more mindful approach, they not only improve their erectile function, but they also find self-pleasure to be a far more deeply satisfying and emotionally resonant experience. Now, while gentle touch and mindfulness are crucial for retraining your sensory system and your brain, there is another key physical component that is often overlooked, but incredibly powerful for erectile health: your pelvic floor muscles. Our third solution is to actively strengthen these vital muscles through targeted exercises, often referred to as Kegels. The pelvic floor is a sling of muscles that sits at the base of your pelvis, supporting your bladder and bowels, and playing a critical role in sexual function. These muscles help control blood flow to the penis, support erections, and even aid in ejaculation. Think of them as the foundation for your erectile function. When these muscles are weak, blood might not be able to flow into the penis efficiently enough for a full erection, or it might not be able to stay trapped there long enough for rigidity to be sustained. So, how do you find and strengthen these muscles? The easiest way to identify them is to imagine you are trying to stop the flow of urine midstream, or trying to prevent passing gas. The muscles you engage are your pelvic floor muscles. Once you have identified them, the exercise itself is simple: gently squeeze and lift those muscles as if you are drawing them upwards and inwards. Hold for a count of 3 to 5 seconds. Then slowly relax for a count of 3 to 5 seconds. The key is to isolate these muscles and not to engage your buttocks, thighs, or abdominal muscles. You should be able to breathe normally while performing them. Start with a few repetitions, perhaps 3 to 5, and gradually work your way up to sets of 10, 3 times a day. You can do them anywhere, sitting in traffic, watching television, or even lying in bed. It is like exercising any other muscle in your body. Consistency is key. Men who regularly perform Kegel exercises often report not only stronger, firmer erections, but also improved control and a greater sense of confidence in their sexual abilities. It improves blood flow, supports the rigidity of the penis, and can even help with preventing premature ejaculation, all of which contribute to a more satisfying sexual experience. This is a simple, private exercise that can yield significant benefits for your erectile health, helping to provide that underlying strength and support. While specific techniques and muscle training are vital, none of it works in a vacuum. Our overall health is intrinsically linked to our sexual health, which brings us to a few broader, yet equally crucial, habits you might overlook. Now, let us broaden our focus to some fundamental lifestyle factors that directly impact your ability to get hard, often more profoundly than you might realize. This forms our fourth crucial solution. Many men, as they age, face increasing risks of conditions like heart disease, diabetes, and high blood pressure, all of which can severely impair erectile function because they damage blood vessels. The good news is that by making conscious lifestyle choices, you can dramatically improve your overall health and, by extension, your ability to get hard. First, consider your diet. Eating a heart-healthy diet rich in whole foods, fruits, vegetables, lean proteins, and healthy fats is paramount. Think colorful berries packed with antioxidants, leafy greens like spinach and kale that are rich in nitrates which your body converts to nitric oxide, essential for blood vessel relaxation and blood flow, and healthy fats from avocados, nuts, and olive oil. Conversely, reducing your intake of processed foods, excessive sugar, unhealthy fats, and too much red meat can prevent arterial plaque buildup, which is a major contributor to erectile dysfunction. Proper hydration is also essential. Simply drinking enough water throughout the day helps maintain healthy blood volume and circulation. Next, regular physical activity is non-negotiable. You do not need to become an Olympic athlete, but consistent, moderate exercise can work wonders. Walking, swimming, cycling, or even light resistance training for just 30 minutes most days of the week can significantly improve cardiovascular health, reduce stress, help maintain a healthy weight, and even boost testosterone levels, all of which are vital for erectile function. Exercise helps keep your blood vessels supple and efficient, ensuring adequate blood flow to the penis when it matters most. Then, there is sleep. The importance of quality sleep cannot be overstated. During deep sleep, your body repairs itself, regulates hormones, and produces testosterone, which is crucial for libido and erectile strength. Chronic sleep deprivation can throw these systems out of whack, leading to decreased desire and poorer erections. Aim for 7 to 9 hours of uninterrupted sleep each night. If you struggle with sleep, consider improving your sleep hygiene. A consistent sleep schedule, a dark and quiet room, and avoiding screens before bed. Lastly, effective stress management is key. Stress and anxiety are silent erection killers. When you are stressed, your body releases hormones like adrenaline and cortisol, which constrict blood vessels and divert blood flow away from non-essential functions, including erections. Finding healthy ways to manage stress, whether it is through meditation, deep breathing exercises, spending time in nature, pursuing a hobby, or connecting with loved ones can make a profound difference. Additionally, be mindful of alcohol and smoking. Both are detrimental to vascular health. Smoking severely damages blood vessels, and excessive alcohol consumption can acutely impair erectile function and, over time, lead to chronic problems. While these habits offer powerful self-help solutions, it is also crucial to know when to seek professional help. If you have been making these changes and still find yourself struggling, or if you have underlying health conditions like diabetes, heart disease, or prostate issues, please do not hesitate to talk to your doctor. Erectile dysfunction can often be an early warning sign of other serious health problems. and a healthcare professional can help identify any root causes and discuss further treatment options, including medication or other therapies. It is not a sign of weakness to seek help. It is a sign of taking proactive control of your health and well-being. So, we have talked about moving away from harsh techniques, embracing gentle touch, connecting with your body through mindfulness, strengthening your pelvic floor, and nurturing your overall health with good diet, exercise, and sleep. Remember, making these shifts is not about perfection, it is about consistent progress. Even small, consistent changes can lead to remarkable improvements in your sensitivity, blood flow, and overall confidence. Your body is incredibly resilient, and it is never too late to start treating it with the care and attention it deserves, allowing it to heal and respond more naturally. I truly hope this conversation has given you a fresh perspective and some actionable steps to take. I would love to hear your thoughts and experiences in the comments below. Have you tried any of these approaches? What has worked for you in rekindling your vitality? Your insights can be incredibly helpful to others in our community who might be facing similar challenges. If you found this video helpful, please give it a thumbs up. It really helps us reach more people. And consider subscribing to the channel for more practical advice on living a vibrant, fulfilling life at any age. Your support helps us share valuable information with more men who might be struggling in silence. You deserve to experience intimacy and pleasure fully. Take these steps, be kind to yourself, and live your best life at every age.